Hey everyone, and welcome to Make Business Better. I'm Zach Seward, the co-founder and CEO of Quartz, and every Tuesday at 11 a.m. Eastern Time, we're inviting business leaders to come on and share one way in which they're working to make business better in their work or lives, and to share some practical tips that we can all apply in our work and lives to take away from. Today's topic we're going to be talking about is the intersection of public health and the private sector. And to discuss that, we've got a great guest, the Chief Medical Officer of Salesforce, Dr. Ashwini Zenooz, will be joining us in a second. We'll talk to Ash about what that job entails. Of course, we'll talk about the past year, which I imagine has totally transformed much of her own day-to-day work, and discuss what the role of a chief medical officer in non-health companies might look like in the future. But as always, we should start with the Quartz essentials. And I thought for today, we should start with the basics, which I'll admit I had not, until we booked our guest today, heard the title Chief Medical Officer used, at least not outside the setting of a hospital or other more obvious context. So looked into just a little bit about this title, which has certainly been on, is still very uncommon in most companies, but on the rise over the last decade. Typically it's filled by MDs, of course, who are focusing on one of either the health of a company's own employees, or depending on the company and the nature of its products, the health of its customers. And in essence, acts as an in-house consultant on anything related to, again, whether it's health of employees or health of customers. I think a function that has existed within consumer goods companies and even technology companies for some time, but hasn't been part of the C-suite until much more recently. And still, as I said, it's still a pretty rare job title. So that's my take at Chief Medical Officer. For the much more expert take on that job title, we should bring in our guest, Dr. Ashwini Zenooz, the Chief Medical Officer of Salesforce. Ash, welcome.
Thanks, Zach. Happy to be here.
So how did I do? Is that, how do you describe yourselves at the dinner party when we used to have those, and someone maybe piques their curiosity at the title Chief Medical Officer?
Yeah, I usually tell them a Chief Medical Officer it really varies on the company. Of course, I'm a clinician. I'm a radiologist by background. I've been in government before, in public health, leading efforts. So I think it really depends. When I was Chief Medical Officer at the Department of Veterans Affairs, I had a different role than I do at Salesforce. But really, when I first got to Salesforce, my role was really along strategy and building solutions to bring our products and make it relevant to our customers, right? It was much more along the lines of more holistic solution strategy, and how do you communicate with the customers, and how do you speak the language of the customers, right? It was the overall Salesforce strategy.
And sorry to interrupt, but it's specifically customers in healthcare?
Yes, healthcare and life sciences. When I first started here, of course.
Right.
And then, of course, I come from a public sector background as well. So it made a lot of sense because, of course, in this country, you've got public sector customers like Health and Human Services, the VA, parts of the DoD. But when you look outside of the United States, most of healthcare is really integrated into public sector, right? Public health pays for a lot of the stuff. So it made a lot of sense to also bring in public sector into the conversations, not just commercial customers. So it was really focused on strategy. What do the customers need? What type of products do we have? Do we have the right type of compliance, right? We want to make sure that our data, the data that's coming in is safe, that customers trust us to use the data, et cetera, right? So that's sort of where I was thinking. And then, of course, last year, everything changed and the pandemic hit. And so my role has evolved. I've gotten a couple more hats that I've taken on, and now it's much more difficult to describe what I do. But I'm happy to do that.
Yeah, let's take a stab at it. So, if you could try to think back a year or more ago, and when roughly was the first meeting inside Salesforce, at least what you were called into, where I'm imagining the conversation was like, well, is this coronavirus thing going to be a real threat? Then do we need to be preparing? When did things start to tilt and your focus turn to the pandemic?
Yeah, I mean, I would say very, very early on. Even though we're a technology company, I think the one thing I can say about Salesforce, and it's one of the reasons I joined this company, it's because I think that our management team has their finger on the pulse, and they understand each customer, and that's why we went into industries. So, not shockingly, our fiscal year is February 1st, so I remember it very clearly. We were thinking about kickoff, and a lot of us were coming together in Las Vegas, and I was watching what was happening in Wuhan and things trickling into other parts of the world. And I remember sending a note up the chain to the senior management team, and I was like, you know what? I think we should stop travel. I'm really concerned about what I'm seeing. There wasn't a whole lot of data, but based on like the patterns of what was happening, I was like, I'm really concerned. And I think that was the beginning of me taking on an additional role in this company, because it quickly became apparent in Asia and other parts of Europe, right, that this was spreading really quickly, and that this was going to be at that time an epidemic, which then became a pandemic. So I was brought in really quickly to start thinking through, like, what does this mean? Do we stop travel? Is it just in the United States? Is it worldwide? How do we think about office space, right? All of these things started coming into the conversation. And quickly we put together a COVID committee, a task force, to think about not only about our own employees and how do we think about things, but how do we work with our customers? Like, what is it that they need, right? What's happening around the world? And how is this going to impact how we interact with our customers? So that was the beginning, and that was really early in February. And by March, we'd already heard about, at least in the United States, frontline workers not having enough PPE, right? Masks, gloves. I'm a clinician, I go out and I volunteer. People didn't have stuff on the front lines, and we mobilized a team to go out and get 60 million PPE and started delivering it. And that was very early. That was March of last year.
And in that case, that was for the PPE were for medical workers writ large. Got it.
Yeah.
And that just part of Salesforce trying to do something to help out early in the pandemic.
Yeah, I mean, it was nothing to do with technology. UCSF, I think it was the dean at UCSF that reached out and said, our folks are struggling. We don't have enough masks and gowns. Like, this is serious. And our CEO said, you know what, we've got to help. What is it that we can do? We are a big company. We have a voice, we have a platform, and we know a lot of people, and we're connected to every industry. How do we connect the dots? And one of our senior leaders said, I'll help. I'll put together folks, I'll connect the dots. Let me bring in logistics help. Who's going to fly things out? Let's talk to Alibaba, right? Like, who can get us as much PPE as possible so that we can get it out to as many frontline healthcare workers as we can to keep them safe. And that was the beginning of, when we started working on this together. And that was the beginning of me coming to the table. And like I said, that was really, really early on in this company.
Flash forward now a year. I think everybody running a company of any size kind of improvised their way through those first few months in terms of making decisions about employee safety. We now know a lot more about the pandemic, and fortunately can look ahead to a return to normalcy, so to speak. How would you advise people who are in charge of making those kind of decisions for their own companies, but maybe a little less equipped than your team at Salesforce? Like, what are the factors they should be looking for to determine when, for instance, to reopen an office? Like, what are the major points along the timeline this year that will allow that safe return to work?
Well, I'll come to the safe return to work, but I think I'll start off by saying, we have pretty good data. From very early on, governments around the world started releasing data on the number of active COVID cases, the number of tested cases. We've all seen the dashboards, the number of hospitalizations, the number of deaths. Those latter two lag behind the number of cases. So it's a really good indicator to take all those into consideration to say, how many cases do we actually have? How many people do we have hospitalized with COVID? And how many people are dying? And it's sort of like a continuum. A pretty good indicator to showcase like what's happening on the ground, right? So at least for us internally, we started looking at all of this data and actually collaborated with other companies in the area to understand what data they were looking at, and then worked with governments to really understand what was important to them in evaluating peak, were things dropping, were they looking at numbers the same way, right? So we really use these numbers to help us understand if the number of COVID cases are declining. If the cases are declining and the hospitalizations are declining, then we're expecting that the country or regions are trending in the right direction. So, sure. And of course, now we've got vaccinations, so we're now tracking to see what percentage of the population is getting vaccinated, how close are we to herd immunity. Those sort of factors really help us figure out whether we're going to reopen offices. And just to come back to returning to work, I think over the course of this year, we've learned that, perhaps not everybody needs to return to the workplace and not everybody needs to come back full time. And so our posture and our thinking has really evolved inside of the company. We may not all be coming back into the workplace. And so we're thinking about what that means to our employees in terms of the tools that they need to work more effectively from wherever they are.
Mm-hmm. Yeah, same for us. Even those living close to our headquarters will have be able to make the choice of where they end up working from. And you're right. I mean, it changes basically everything about how you think about company. Are you one question we have to decide? I'd be curious if you've made a policy decision on this as well. Are you going to require for employees who do want to work in an office that they be vaccinated?
Look, it's a little bit more complicated. We're a multinational company, right?
Sure.
We're in lots of regions, so we have to follow like local regulation. Some governments are going to require it, and therefore we have to require it. But in places where the governments are not requiring it, I think we'll just have to work with them to see what's safe.
Which includes the U.S.
Which includes the United States, right? And so we're going to follow the guidelines for now. We have not made a decision on that. But, we do have small groups of people and management teams coming together for meetings, et cetera, for collaboration. And, we're using the magic of PCR testing and on-site testing. And if people have been vaccinated, to make sure that people are coming together safely. So while we're waiting for broader guidelines, we're using common sense and science, right?
Right, and of course the rollout, still has a long ways to go. And I know Salesforce is involved in that as well. And in a way, the challenge of vaccinating the whole world's population strikes me as a perfect use case for a CRM. Although I assume that is not precisely how Salesforce is being used in this. What ways have you gotten involved in the vaccine rollout?
Yeah, I heard Mark say on PBS yesterday that we sort of came into this by accident. To me, being in healthcare, I always knew that CRM was so important, which is why I came to this company. I think for us who've been on the healthcare side, especially in public sector and have dealt with natural disasters and other types of infectious disease breakouts, you recognize that we don't have those dashboards. We don't have command centers. We don't have visibility into what's happening on the ground, right? And it's almost like we keep reinventing the wheel every time there's a breakout of SARS or Ebola or swine. Take your pick. And I hope that this finally is the pandemic that's going to set something into motion where we have a template and we're going to build on top of it, because companies like Salesforce have really added a lot of value. Back in May of last year, we released something called work.com. And as to what I was talking about, it really brings together a command center. It has all of the tools for emergency response management, has contact tracing tools, because at the core of it, CRM technology, in addition to we have MuleSoft and Tableau, can bring together all sorts of disparate sources of data into a single place so that you can make decisions really quickly. And that's the essence of CRM, right? And if that is so important during a pandemic to have all of that data in one place. And we released that as work.com back in May of last year, like I said, and then we started slowly adding some vaccine capabilities. We thought it would be helpful, and we quickly realized that these capabilities weren't broadly available and tied together with the capabilities of work.com. So then we came out with Vaccine Cloud in January. And again,
I'm sorry. And what does Vaccine Cloud do?
Yeah, it's really all a lot of different products for Salesforce products that are coming together to provide end-to-end vaccine management system. It sounds
for a public health authority or a pharmacy that's in charge of distributing it. Got it. Okay.
Well, it's everything from like logistics and scheduling of your patients, tracking outcomes, reporting to databases, right? It's all the things that CRM does. Initially, governments had a lot of uptake, but we're now at, I think, at like 50 customers, federal, states, nations, et cetera, around the world are using this. And yeah, it's really grown into now beyond just government, right? Nonprofit, you've got educational facilities, you've got hospitals. They're all using these capabilities to get people vaccinated, to do the last mile, right? You can have all the vaccines in the world, but if you don't have people vaccinated, it doesn't get you herd immunity, and you really need technology to help there.
Well, I'd love to dig into this as our last topic today, because it's really striking, and what you're saying, and I think probably the most important takeaway is we do seem to reinvent the wheel with each new public health crisis, and I like the optimistic view that maybe we could use this as a way to do things differently. It would seem to me that the root of a lot of the issues you're identifying is the lack of a nationalized healthcare system in the U.S. At least, well, whether that's a good idea or not for other reasons, would certainly make it more difficult to roll out a national vaccine without this like patchwork of systems. Are there other countries that you are seeing now with the vaccine rollout, whether they have nationalized healthcare or not, that are doing a better, or at least less scattershot job at the rollout that the U.S. should take inspiration from?
Let me start off by saying, I think at the core of these types of managements during disasters of any sort is leadership. You lead by influence. So I don't think you necessarily have to have a nationalized healthcare system to do this right. It's really about, influencing and incentivizing and having a federal task force that incentivizes your states and regions to come together, to work with you, to share the data, to make sure that you're all like working together. And that you have transparent, clear communication so that you reduce any sort of hesitancy, right? I think Israel has done an amazing job of this, end to end. I think in the middle, they had a little bit of a dropout because they got people vaccinated and didn't tell them that it would take them a couple of weeks to get that immunity after the first dose, and they have to come back for the second one. So you saw a spike. But they've really gone in and changed that, right? So if you look at Israel, they're really doing a great job of, and they are a nationalized system where they're using their insurance providers to send out for scheduling to get people into the systems, to get them scheduled. They're tracking, they're communicating. I think all of that is great. We're also seeing parts of Asia, like Singapore has done a great job, not only with vaccinations, but also just in general management of COVID. Australia, I was talking to my colleagues the other day, and they're in their car going to client sites and having meetings. Again, this is more about COVID management, but I think what I'm trying to say, it's a lot more about having federal leadership and being able to coordinate and get people together. Parts of Europe, are lagging behind. Unfortunately, you've got a lot of like focused, localized regions that are not communicating and sharing with each other. And maybe it's part of leadership, maybe it's part of people coming together and not being a federal central system, but they are lagging. And so we're seeing a lot of, disparity in this, in how vaccines are getting rolled out. It is a little bit concerning to me because the faster we can get people vaccinated, the faster the world gets herd immunity, the faster that we're all back on planes and seeing our friends and families, right? So.
Yeah, no, those are helpful examples, and yeah, certainly, regardless of how patchwork it has been, in the U.S. especially, it is an impressive ramp up in distribution, and in the end, I suppose that matters most. What is it, short of a totally nationalized healthcare system in the U.S., that the public sector would need to change to make these public-private partnerships around public health work better? I'm thinking of, in the early days of the vaccine rollout, there were some stories about local health authorities using, Eventbrite to book vaccines, and it was painted as like an ineptitude on their part, but seems like a probably pretty good system for booking things, right? Not quite as good as work.com, but what is like. But I think really what people were criticizing there is like, it's just totally patchwork. There is no way to simplify the system for people, and so your prior job was modernizing the medical records of the U.S. government. So if anyone should know, it's you. Is there a better way to do this?
Yes, I think healthcare and public health share something in common. It's that it's really fragmented, and unfortunately, from a technology perspective, it's been really archaic. The one positive thing that the pandemic has done is really reinforced why this transformation in digital health is so important and necessary. And I feel like, it's boosted the transformation by about 7 to 8 years ahead of where I was expecting it to go, right? It's gone. So I think all of those are positive things that have come out of this pandemic. Look, I think, there's fragmentation in healthcare and there's lack of interoperability. I mean, there's the ability for you and I to share our vaccine data freely, share any sort of health data. It's not like, we do with an ATM. You can't just show up at an ATM and withdraw your health records or put in your health records. It's not easy. You can't do it on your phone. It's really hard. And I think that's the crux of it. I think what people have failed to recognize, we keep calling technology a tool, and it is, but it's a really powerful tool that can accelerate your digital health transformation. And I think that's what this pandemic has brought to bear. It said, all right, folks, like, technology is a great accelerator to what you're trying to do. So let's actually use it. Let's not silo our transformations between public sector and private sector. Let's bring all of these groups together and set a template, set a standard, and say, this is what we're going to operate on. And let's make governments, including the COVID task force and any sort of pandemic task force that stays on, tech enabled. Let's make sure they have the ability to have that command center, not just for today, but for the future. They can visualize hotspots, they can communicate, they can get all the data. Think about, being predictive, having predictive models. Let's enable governments and hospitals and, other companies to be able to manage this in a way that we do everything else in our life, right? With whether it's direct to consumer like Amazon or how we manage, our sales process. Let's make it seamless. And I think technology is a great accelerator to do all those things.
I've been wearing an Aura ring on my finger for the last few months, and I'm desperate to upload. I want that data to get out of the app, which is a great app. I should say to anyone who's interested, but and to my doctor, so they can start doing stuff with it. We'll have to have you back on for another half hour to talk entirely about the privacy implications of all of that. But I totally agree. It would be the right step in the right direction. Really appreciate your coming on. Talking about this. I'm sure it's been a hell of a year and will be a really interesting one ahead for you. And I have to imagine your colleagues felt lucky that when this pandemic broke out, they were able to turn around and say, do we have a chief medical officer? And find one that there will be a few more of you and with titles like that at large companies after this pandemic, I have to imagine. Thanks a lot. I appreciate it and hope you have a great rest of the day.
Thanks, Zach. Happy to be here.
Thanks. That's it for today's episode of Make Business Better. We'll be back here next Tuesday at 11 a.m. Eastern Time talking business ethics with Allison Taylor, the Executive Director of Ethical Systems at NYU. See you there.